Hello, it's Dr. Jack Zamaris, plastic surgeon at Artiste Plastic Surgery, and I just wanted to take this moment to speak to my patients and prospective patients and followers out there that it is definitely unprecedented times in Australia, and like everyone is a little bit panicking, everyone's a little bit alarmist about things, everyone has a little bit of anxiety, but we are all in it together, and it's important to take note of the New South Wales Health and also the government advice on what we are doing. So far, what we are doing is practicing suppression to help suppress the virus, and that way my medical colleagues on the front line are not overwhelmed with new patients. It's important to note that everything is under control. So far at Artiste Plastic Surgery, we are practicing social distancing in terms of waiting room chairs being spaced 1.5 metres apart. We are using hospital grade disinfectant every 25 minutes in the practice, and we are spacing out patient consultations. Just to give you some perspective about the virus, because I think education is power, and if you know a little bit about it, you understand why these measures do work. So it is a respiratory virus, means it's transported through respiratory droplets, and hence the 1.5 metre rule. So if someone was to sneeze and didn't practice etiquette, if you're at least 1.5 meters away from them, then you wouldn't get the virus. So with those measures and good etiquette, so sneezing into your elbow, then will minimize any chance of transmission. But in terms of what is a virus, first we'll talk about living cells. So we are made up of living cells. So for example, we have hair cells, we have skin cells, bone cells, heart cells. So this living cell, if you imagine it as a circle, in our living cell, and I'm talking about a human living cell, which is called a eukaryote, you have a nucleus, which is our DNA. That's where our DNA is. You also have other structures in the cell, like mitochondria, ribosomes, which make protein, and other various things. And we have receptors. So this human cell is what makes up a certain thing. And all animals, including us, are made up of living human cells. When you have bacteria are somewhat simplistic human cells. So they're not human, obviously, it's a bacteria, but they also have a cellular structure. So bacteria are alive. So we have bacteria that live in our nose normally, and also in our gut. Now this bacteria, like the human cell, has a nucleus, but it lacks other things. So some bacteria don't have a sophisticated cell wall like ours, and bacteria can cause infection by invading human cells, but they cause infection on their own by provoking an inflammatory reaction from us. But they can live on their own. Bacteria can live on their own. So what a virus is a virus doesn't even really resemble a cell at all. All a virus is an encapsulated or non-encapsulated piece of DNA or RNA, and that's all it is. It doesn't have any other structured cell. It doesn't resemble a bacteria, and it's certainly not a human cell. So a virus cannot live without us. And that's the whole key with the virus. So a virus needs us to replicate. And that's why social distancing and quarantine, which is going on around the world in certain parts of the world, actually works. Because if we separate from each other and separate those that are potentially infected from those that are not exposed to those that are infected, then the virus actually can't grow because it needs a human cell. And that's the key with viruses. At the same time, that's why viruses are dangerous, because obviously we can't attack our own cells, and it takes a while to get vaccinated against a virus, and there's not a lot of antiviral therapies there. But by practicing social distancing, which has been implemented in Australia in the last week, that should suppress the virus ability to basically go through society at a rapid rate. And that's why social distancing does work, and we encourage everybody to do it. So I hope you understand a little bit more about the virus. And as always, please keep following us and stay safe.